Hi, I'm Corinne Santore, owner and therapist at Santore Associates Health and Wellness. I work specifically with first responders, helping them to improve their mood, engage and be more present at home, and reignite the passion for their career. Do you wonder why you can be on at work, you can be professional, yet feel the exact opposite when you're at home with your spouse and kids? Are you having trouble sleeping, even when you're off duty or on vacation? Do you find yourself losing your temper at small things, even the shoes that you're tripping on when you walk in the door? Have you lost the passion and excitement for your career, or fear that you will? You aren't alone, and likely the majority of your crew is feeling the same way. I help first responders feel in control of their mind, emotions, and overall quality of life. I'm going to tell you about what I see in my practice, a little bit about what therapy is like, some logistics so you feel more prepared about what to expect and how to know if you should give it a try. What makes your career so unique that you need someone who specializes specifically in treatment of first responders is the fact that your job is just different than the rest of ours. You have to be on for 24 hours, and whether you're in the most busy department in the city or the slowest, you never know what you're going to get. You have a bond with the guys that you work with unlike anybody else. You live together, work together, see the worst things people can imagine together, and your lives depend on each other. And that's hard to transition from that brotherhood back into your personal life and feel that sense of connection that even equates or could be described to your significant others and family and friends that don't understand, or they think that they're just sitting around in their Barca loungers watching football all day and that they have a pretty easy job. So there's this dissonance and lack of connection with their family and friends, and it makes it really hard to transition from being on the job and professional to at home and at ease and relaxed and really refreshing before the next shift. So why it's important for you to see somebody who is familiar with the fire department and who gets it is because there's a lot of nuances of the job. The A, B, C shifts and the personality differences that happen in all three of those shifts, as well as the personality dynamics that happen amongst ranks and promotional exam dynamics, and how they need to be on in a certain way depending on their level of years in the service or position. And what I hear a lot is that people will go to a therapist and 3 sessions in, they will have spent that whole time explaining the culture and the dynamic of the fire service without ever really addressing their symptoms and getting to what brought them in. And many people's spouses don't understand, or after a few years are tired of hearing about that because what they need is you home and helping with the kids and the house, or you're also managing a second business and things like that. So there is a lot of nuances of this job that is important that your clinician really understands so that you can get to what brings you in. Can you imagine going on a call and not putting rubber gloves on? Especially not now, post-pandemic. But in the 1980s, it wasn't normal to put on rubber gloves. It wasn't until the AIDS pandemic that it became the expectation, and now you wouldn't dream of going into somebody's house or on a scene and not putting your rubber gloves on. In my ideal world, therapy would be like putting on rubber gloves. You'd be in paramedic school, and as they teach you to put on rubber gloves, they will also teach you that going to therapy is just part of the job. And you will get a list of the local therapists that are familiar with your profession, and this is just what you do. Sometimes you will see them more frequently than others, and you wouldn't imagine doing what you do every day without a therapist on staff. What I'm most excited about is partnering with you to make mental health care the new rubber glove. And what is awesome about your profession is that it provides you with excellent health insurance that typically covers a specialist. And so give our office a call and we will verify your benefits and make sure that we are a network, but you don't have to see someone who doesn't really get your profession. You can go straight to the specialist and begin the work to feel better and to feel more alive and engaged in your personal and professional life.